up, guys? John here. Titan Talk Tuesday, getting down. So it's one of my favorite months, and obviously it's February. This month is it holds a special place in my heart, I guess. What's up, guys? I'll wait till you guys all come in, but it's February. It's a great month. We got a lot of great events going on, or coming up, I should say. My birthday's this month. I'm a Pisces, so the 23rd is my birthday. It's my favorite number, favorite month, and that's the reason why. Plus, it's Valentine's Day. I'm a hopeless romantic, right? So I made sure that, I do right by Tsikouris and get her what she wants. Any pump and pose? Any pump and pose. So what? So, like the pump and pose? Yeah. I guess, or I don't know. I have no idea. So that's what it was. But yeah, so make sure. So if it's Valentine's Day and you got a significant other, make sure that you're taking care of them the right way. Physically, mentally, do something that you go out of your way that you never do usually. And they'll appreciate that, I promise you. Even if they don't show it, they will in the back of their head think, oh, wow, he did that or she did that for me. So it's really cool. Oh, Dr. Big 50. Big ups to you, bro. So, yeah, I mean, I'm turning 38. He's turning 50, so congrats to him. He's got 12 on me. He's doing well, too, so that's awesome. Good job, Justin. You're the man, dude. So we've got events coming up. We've got the therapy of the week, which is Sildenafil and Tadalafil, and those are the Superman and Wonder Woman therapies. We'll be talking about those. And we had a therapy the week previous, was another libido enhancing therapy, and that was our PT-141, or the Cupid's candy, which had a couple of things in it, a great mix actually, a PT-141, Tadalafil, and Oxytocin. But you can get it by itself or with the others. It just depends on you. Everybody's different, and everybody's experience is different, what they're going for, or if it's for male or female. So at that point, that's a great choice. We've got a lot of great libido-enhancing therapies. So we always talk about those, but there are different ones out there. So basically, there's Scream Cream. That's what we call the therapy. And it's a cream that a woman rubs on her vaginal area at that point, and it pretty much like plumps the G-spot and makes like the outside like more sensitive, I guess. So at that point, the woman's supposed to get more pleasure. The only drawback, I guess, to that libido-enhancing therapy with the cream is when you apply it, it's applied, and it's fine. It's not toxic. It's biodegradable. You can't eat it. I wouldn't recommend that. But, at that point, the oral portion is pretty much out the door, I would think, for you. But the pleasure's there, so at that point, if you're just worried about that, then, it's a rock and roll therapy for women. Oxytocin's used a lot and brought up a lot. I don't bring it up as much as a lot of places do, and the only reason is I'm a straight shooter. Now, if you look it up on the internet, it really does, go crazy. Doesn't post prices for their stuff, wants everybody to call for prices. Okay, so Crazy Hawk, I will answer your question about pricing here in 1 second, okay? So Oxytocin is usually pumped up a lot. Now, Oxytocin works for some people in a real good way. What they usually use it for right now, to be honest with you, is when women are in labor, they shoot them up with Pitocin, which is Oxytocin, and it basically makes the fluttering. So it makes it spasm to help give birth. And that's the reason why they use it. So, but for women, it could help give you an orgasm. So I guess with the contact or whatever it is, and the spasming, I don't know. Therese has taken it. We've had a good experience with the injectable. The Cupid's candy worked pretty good, but not as good as the injectable, I guess. But it was a lot larger of a dose. So for risk versus reward, as far as injecting and getting the pleasure out of it, I do think maybe a heavy dose, but not all the time. It's not really, for me, viable. So I don't want to do it every time like that. But the Cupid's candy does good. Get a swole tongue by eating it. I don't know if you get a swole tongue by eating it. I guess it would plump it up maybe a little bit. I don't know. All right, so I'll answer Crazy Hawk's price real quick. It says, so why he basically says, why does Titan not post prices for their stuff? They want everybody to call for pricing. Okay, so it depends on what kind of pricing you're looking for. Now, if it's a vitamin amino acid pricing, you can look at our sister site, which is tmnrx.com. And that has everything except for hormone replacement therapy, lab work, and all that. For hormone replacement therapy, the prices we put out there, it's not on the website per se because it's not cookie cuttered and everybody's different. A lot of the places that you see the prices on the, for, you're going to get this much testosterone, this much HCG, this much estrogen blocker and anastrozole, this much is for it is a month. You can't compare that. That's a very cookie cuttered system. And it's not personalized. The dose can be personalized. It can go up and down. So that could play a factor in your package pricing. A lot of different things. So it usually runs between $225 and $375 monthly, and that's usually across the board. So if that's what your question is about HRT, it's very, very straightforward. And I know we put it out there, and I write on every one of the questions. I try to on social media, wherever you found us at. That's the pricing, and that includes all your hormone replacement therapy. For males, it usually does include testosterone, HCG, and a Remedex, which is an anastrozole. And at that point, compare dosage to what you're getting. Some people say your pricing per month is crazy high compared to what this 10-week program is. So check this out, crazy. So 1 month program on, let's say, 300 milligrams per week. That might last a 10 ml vial for a patient 1 month, right? But you go to Clinic B and it's 200 milligrams a week. That bottle will last for 10 weeks. So compare dosage and pricing. And actually, man, if you look at it, you're paying more if you go that route. It's just drawn out a lot longer and you're getting a lot less per se, right? Do you take FSA accounts or for payments? Yes. So HSA, FSA, we do take. But disclosure, full disclosure, like always, you know I do it. Some want diagnosis codes. We do not produce diagnosis codes. So check with them, before you want to sign up or use that card, and just be sure. I never want people to get caught in that situation where they owed a big bill or a back pay or anything else. It's very, very important to me. So that's, I want you to do that. Oh, nice. The Punisher, he got his replacement. Nice. Dude, love you too, man. Protect us. We appreciate it. You do what you're doing, man. I appreciate it, Pat. All right, so kind of dug into the libido enhancers right away when I didn't really want to do that, but, we got into some of them, and I tried to answer some questions on some pricing and stuff like that. So you live out of state for hormone replacement. You can call us. So, guys, we service nationwide in blood testing, right? In your zip code, we do it. Hormone replacement therapy, bioidentical for males and females. Vitamin amino acid injectable therapies. We have niche custom blends that Just Titan has for our patients that you're not going to find at any other clinics. It's one of the best blends. Bone all the way through, dude. I mean, bang for the buck. It's all the way through to the bone. The best you're going to see. Medical weight loss, rejuvenation detox. That's a big one. So when I talk about rejuvenation detox, it's not like drug detox. It's like for liver functions, like ALT, AST. We actually blood test that, the full blood panel, and we see where those numbers come back. And a lot of the time, those numbers come back high. And that could be from an oral supplement. That could be from, fatty foods. You can have fatty liver. It could be from, acetaminophen, taking a lot of it, alcohol abuse, from a lot of different things. And when your liver is not functioning properly, obviously your body's not going to function properly. It's like the filter of your body, right? So you want to make sure that is working properly, working optimal levels, and clear and free. So you guys can, feel better, not be sick, and get optimal performance out of your body. Thoughts on HCG? I'll answer this question, I got to go to events, guys. All right, so thoughts on HCG. HCG is awesome, right? It just depends what it's used for. Now, HCG weight loss, Now, HCG weight loss is a thing where if you inject HCG is not going to provide like a fat burning per se function. It's not going to burn fat off you. It's not a fat burner. So people get that confused. The 500 calorie diet, we don't agree with it here at Titan. I don't agree with it. I know the doctors doesn't agree with it. I think anybody at 500 calories is going to lose weight, right? The whole point is to losing the fat off you though. So with it, you basically are stimulating, the other hormones in the body. And at that point, that's making sure your body's not going to a catabolic effect. And at that point, you can do that calorie deficit. And I think it works really well, to be honest with you, for that. I did try it. So in the beginning, when we first opened the clinic and all the doctors were pushing HCG weight loss, that was a huge thing. Huge. We didn't get into it. We didn't believe in it so much. And honestly, I wasn't behind it. And usually we try with all the therapies. So I really didn't try HCG for weight loss. I always used it for add-back therapy with my hormone replacement therapy. And for hormone replacement therapy, it's definitely a must. You can see it. It's going nationwide as far as all the doctors in hormone replacement therapy that know what they're doing. They have that in their programs, and they're understanding why. So back to the HCG weight loss. At that point, calorie deficit, I think it works really well. I don't think it's a fat burning per se, and you got to watch out who's taking it. Some women like PCOS, that can be bad. There's a couple different things. So that's why a medical professional should be making the recommendations and prescriptions, like a doctor or an ARNP, right? A nurse practitioner. Somebody has a medical license and a DEA license. Somebody that can really, really tell you what's going on. All right? So I hope that helped. All right. So let's get into our events, and then I'll go back to this. I'm getting stuck here on these questions. All right. So, and I keep the questions coming. I love it, guys. All right. So events going on. So this weekend is going to be a busy weekend, I think, right? We've got a lot of different things. Today we got 4 events going on at 4 different crunches. Countryside, Hillsborough, Carrollwood, and I think South Tampa.
Tomorrow.
Is it tomorrow? Tomorrow, excuse me. I stand corrected. Tomorrow. We have all 4 of these going on. I'm sorry, I got the kits today, so I thought they were going on today. I actually personally packed one of these kits. Actually, it was for our Pinellas location in Countryside. I want to show those guys love. I put a lot of Titan gear in there, so if you're in the Countryside area, stop by there, say hi to Cody, mention this, tell him you want some free Titan gear, and he'll hook you up. If he doesn't have any and he's already given it all away, you contact us personally. I'll take care of you. All right? All right, so this Saturday, the posing seminar. It's going to be done at Gold's Gym, Largo, Florida. We're going to do, PCA is going to be doing their posing seminar, and Titan Medical Center will be giving away some free goodies. But go there. There's going to be a lot of great knowledge. So if you don't know how to pose and you're into the bodybuilding thing, it's definitely awesome. I think it's going to be free to get in. So at that point, you'll learn a lot. Maybe something you didn't know. I mean, I'm going to probably learn some stuff I didn't know. I'm not a big poser. I've never done this, anything like that. I've always done the physical thing for myself. So it's really cool, though. You learn a lot of different things. You learn how to, move the body where you can get the best visual.
Pretty sure you have to register. So
you got to register?
Yeah, go online and get your spot.
Okay, so yeah, you got to go online. Well, we'll post a link so you guys can see it. Always, check the newsletter out too. I think it was in there too as well. Anything else going on this Saturday? I think, so we've got an event coming up at Retro Fitness. I know that's coming up. We'll be there. I can't wait. That's a really brand new club here in the area. We've got 2 huge events coming up on April 7th. One is the PCA Titan Classic. 2 is the Festival of Speed. Does anybody know what the Festival of Speed is? It's a huge event here. So we are the only HRT clinic and exclusive to be here at Vinoy Park on April 7th. We'll have the Titan Corvette out there, the Hummer. We're going to have some of our patients might bring out their exotic rides. It's going to be like just a big high-end exotic like car show, I guess. I've never been to it, but 22,000 people last year. Huge. So if you guys are here in the St. Pete area or Tampa area, come out April 7th. come out and check out the Titan Classic, and then we're going to go right over to the Festival of Speed, to the Titan booth and tent. It's going to be all set up. We're also going to be doing the Festival of Speed, if you're in Orlando. Orlando, we already have locked down. So we're exclusive for Orlando too as well. So Titan will be in full effect. That'll be more information coming soon on that, on the date and all time and all that good stuff. But also be in the newsletter too, guys. So I think that'd be really cool. Festival of Speed, Titan Medical Center. We're doing big things. I'm loving it. It's going to be great, guys. All right. Is tattoo bad for your body? I don't know. Tattoo's bad for the body. I don't know. I got 2 of them. You know, I've improved my body since I've had tattoos. So I don't think tattoos are bad for the body. I think tattoos are expression of what you want to put forth, I hope. You know, some people are young and make mistakes and they tattoo things on them. There's tattoo removal for them if they think that highly, if they want to get removed. But for me, you know, it's always thoughts, it's always memories. I mean, especially this is my crest, so it's not bad for my body. It reminds me every day who I am, you know, if I need that, and that's great motivation for me. Titan Medical Center is the next. I'm getting another tattoo, so me and Tsikouris are getting Titan Medical Center tattooed on us. We said when we got to the point in the business where it got to a certain point, we would do it and actually put it a part of us. And it is a part of us every day. We wake up, we live it, we feel it, we breathe it. This is us. So at that point, it's an expression of us. We definitely want to put it on us. So I might get something right here, but that's it after that. I really am not a tattoo person. Like, you know, like tattoo, like if I see somebody with tattoos, like, you know, that's not a big thing for me. It's like I said, it means to me what it means to somebody else. It's an expression of who they are or what they feel or what they want to remember, I guess. But that's it. What if I feel like I'm getting too muscular with HRT? I don't want to accidentally win Mr. Olympia. All right. So HRT is going to, you know, it's going to get you into the levels where you need to be. Going to Mr. Olympia on HRT, I think, is a little outside the bounds unless your genetics are just through the roof. It's just there for a health factor. This is not to get you to Mr. Olympia. Now, can you put on lean muscle mass? Yes. I really think it has to do with calories, your diet, you know, how you're sleeping, how you're training. You know, I mean, I think that in genetics, I think that does play a role. I don't care what anybody says. Genetics plays a role. I've seen people that have not worked out in a day in their life and eat McDonald's, and they are shredded. That's not an accident. They're not taking things. These people, trust me, they hate the gym. And they definitely aren't going to be sticking themselves with no pins. So, or needles or syringes. So at that point, it's done. So I don't think you're going to get that big. But if you get that big, I guess we'll go on some ECA program or a Titan therapy for weight loss. With tests at 201 is injections the only option. I'm concerned about RBC getting too high with them. All right. So with tests at 200, you know, I don't think you're going to have a problem with RBC getting too high. Now, this is different for everybody. And we've seen people on 200 milligrams a week or 300 milligrams a week do different things. Some people, and RBC can increase not just by androgens, but sleep apnea can increase red blood cells. So there's a lot of different things. So research it a little bit more, but you should really think about hemoglobin hematocrit. Now, when RBC, hemoglobin, and hematocrit get high, we've got issues. We want to definitely bring those down. Now, just a little high is not really concerning. You want to donate, great. Getting too high, the blood gets too thick. You're talking about strokes, DVTs, blood clots, bad things. And at that point, you're on blood thinners. Titan Medical Center doesn't touch anybody that's on blood thinners or anything like that because we don't even want to mess around with you getting another blood clot, possibly. So at that point, I think you should be all right. Monitor it. See how it goes on the treatment. If you are having to donate quite a few times, then I would think about, talking to the doctor or possibly about lowering the dosage of testosterone, and that should help. Or you do the donations, and donations will be fine. And honestly, you're saving a life, and they're not charging you. I know here in Florida. All right, if I'm currently with another hormone replacement therapy, but I think I'm paying way too much, how do I switch currently on hormone meds? Okay, so if you're on hormone replacement therapy on another clinic, and you say, you know what? I want to switch over to Titan Medical Center. And with Titan, we're a concierge medical center. We're probably not the cheapest out there, but we do have exclusive things with our clinic. Plus, you're going to get the real follow-up with real medical providers, and you're going to get service whenever you want it. Call, text, email, and you're going to get a response. You're going to get a message that day. So at that point, if you want to switch over, we need blood tests within 60 days, all the lab panels that we require. You need to fill out the new patient paperwork, and at that point, we need to get proof of your prescriptions. Now, proof of your prescriptions means a proof of a medical prescription from a U.S. licensed pharmacy prescribed in your name. Why do I say that? Because just the other day, somebody said, yes, I'm on prescription testosterone replacement therapy. One of the staff members says, okay, that's perfectly fine. Can you please send your proof, please? Okay? Sends in a picture. The bottle has a scorpion on it, guys. A scorpion. Like, all right, man. No U.S. licensed pharmacy is putting a scorpion on the bottle. The other information's not on there. Obviously, it's an underground pharmacy. I don't know where he got it. But we told him. He understood. That's what it is. So, we need the proof of real prescriptions. Here's another thing I heard that's going around. There is people that relabeling or putting out like false medications out there and saying they are real medications from clinics. That's scary. You guys will get caught. I can't wait for the day. I think that's it. As far as questions, let me go on here. What am I feeling I'm too big? Just got my Titan Complete. Makes me feel great. Awesome, man. So he just got his Titan Complete. It makes him feel great. That's awesome. Will help you lose weight. Yes. So Titan Complete is good for a number of different reasons. It has MIC in it, what's methionine, astatylene, choline. It has B12. It has all 3 branched chain amino acids: leucine, isoleucine, valine, excuse me. It has a vitamin B complex in there. So what it's supposed to do is it's help you give you natural energy. It's supposed to help you process fats faster in the body, boosting the natural metabolism in the body so you can lose weight naturally, faster, and feel better energy. All right. Perfect. Awesome. What up, Craig? All right. So let's go on to the next topic. This is a sensitive topic, especially for me. So let's bring up breast cancer awareness. And I know this is not Breast Cancer Awareness Month, but breast cancer awareness is real. It affects a lot of different people, men and females. So at that point, Charisse on both sides has had breast cancer, right? Luckily, she's on, an aromatase inhibitor, and she's blocking the estrogen, and she's not seeing the symptoms or anything, or having any problems yet. Thank God, please. But I've had some friends affected by this. Recently, I know some people that are getting affected by this around the country. And there's a company doing a recall on implants, That's kind of messed up. And the way it is it doesn't happen right away. The implants are in. The body starts absorbing the toxins. And from these implants, they were starting to develop a melanoma, a cancer of some sort. And yeah, the FDA has went on file of saying that it could happen. It's happened with patients with these implants. So at that point, it's real. I think that, majority of women out there, are having implants more and more these days. I think they should be aware of where they're getting their implants, the doctor that's doing the procedure on them. Always getting the lowest price is not the best thing for you. And this has happened time over time again, even with the butt injectable that plumps the butt, where people have died because people were pumping, Fix-A-Flat into the girl's butt. And this happened down in Miami. So at that point, this is kind of scary, these things. So just watch out, be safe, be aware, be cautious. If something happens after that, hey, listen, you did the best you could. And sometimes things get recalled, or some things happen. I've got mesh in me on both sides from a biungual hernia. So at that point, like I have nerve damage. I have shooting pains. And that I think is recalled. I think I can go get a lawyer and probably sue somebody. I'm not doing that. I'm not going to get this mesh out. I'm just going to take it. So that's what it is. So I really want to bring that up. So breast cancer awareness is real. Think about it every day. It's affecting more and more people every day. And I think there's a problem. I think it's hormone related. I think if we checked hormones on a lot of different people in a lot of different situations and fix these problems, I think that we wouldn't have as many issues out there than we are having with cancer and a lot of different ailments. So we were just talking about it today. I had somebody in house, Cody, and we were talking about, like he's a business owner on the go always, and he always has that drive, but something was just wrong that day, and he just didn't feel like himself day after day after day, and wasn't happy with what was going on, and it just wasn't like him. So until he really blood tested and knew, he didn't know like he could feel that good again. So when he did, it was like, man, it's on to go. So at that point, just be aware of how you're feeling, and it's not always, I should just be feeling like this. No, something could be wrong, and if it's mental, physical, it could be hormone related. So just check into it. At that point, you can make a fair decision or educated decision when the numbers come back. All right.
Got a couple comments up here.
All right. That would be cool if you add subtitle for deaf. I will definitely add subtitle for deaf. Read the caption when you speak so I can participate. I would love that, Sherry. I'll have to write. Thank you. YouTube. I can't wait to hear back from staff. I can't wait to hear back from the staff and start my therapy. And credit Titan for saving my life. Daniel, we can't wait to help you, man. Please let us know if you have not heard back from the staff. You can call or text us. It's after 6 o'clock here, Eastern Standard. We are still servicing patients, but the phone lines are turned over. But you guys can always text the line, 727-389-3220. There's always a live person with that phone number. So it's not a bot. It's not a mass message. You're going to get service. We have medical providers for you to talk to or for you to see when you do your visits. So at that point, we got you covered. I can't wait. A lot of big things coming, guys. Other events, Europa, obviously. We've got like a silver sponsorship, I think, with Europa. So we're going to have a huge booth, 20 by 10. Right when we come in the door, you'll see us. I can't wait for everybody's going to be there. We got a lot of giveaways. I can't wait. So T-shirts, bags, pens, all kinds of good stuff. I got special guests coming out for that. More to be announced. If you haven't checked it out yet, Ultimate Health Bible. Guys, it's my book. A lot of great information here. I wrote this with Jeff Bahar, my man. So he is great, knowledgeable, along with me. So it just breaks everything down for you guys. Nutrition, hormones, healthy lifestyle habits, because that's where it really starts. It really starts with your lifestyle habits. It's not a chore. It's not a punishment. It's a lifestyle, guys. And when you guys get into it, you guys will start seeing expedited results. Don't look for overnight results. Don't look for shortcuts all the time. It's not always there. Or you're going to have to give something, whether you're sacrificing health or whatever it may be. Anything else? Any other questions?
Talk about the Titan Evolution Challenge for a little bit.
Evolution Challenge. So, Evolution Challenge is coming. Titan Evolution Challenge. Thousands of dollars in cash and prizes is coming. I'm doing it for two types of people. One that have fell off the wagon of this New Year's resolution. You might be sitting there with a chicken wing in your mouth. I don't know. I would be too. Don't worry. And you guys might think, hey, man, I really want to get back into this. But I have nothing to motivate me to do it. This is going to motivate you. Number two, you people that have been busting butt, you guys are already in great shape and already have a step up. Per se, right? But I'm looking for the best evolution. That means all the way around. From when you start to when you finish. So if you look at 8% now, you better look at least 6% then, right? Because it's drastic when you get to that point. And it's really, really hard to do. So at that point, so you guys be ready for that. I'm going to start taking applications and all that very soon. Sorry. I want to show you guys what's going on. All right, guys. So I am John from Titan. If you guys have not subscribed to my YouTube channel, our YouTube channel, Titan Medical Center, please press subscribe. A lot of great content on there. Injection videos, educational videos, behind the scenes, what we're doing at our events. Me and Tsikouris, A little bit of everything, guys, right? Also, check out our social medias, Titan Medical Center, right? That's on Facebook, and at Titan Medical at Instagram. Twitter is Titan Medical CEN. And that's pretty much about it. If you guys want to tune in to some of the behind the scenes of John and Cherise, some stuff you're not going to see on Titan Medical Center because I just don't think it's professional to put this on our page. We're going to have all kind of behind the scenes and Cherise's soapbox and all that good stuff. So if you're looking for some entertainment, it's definitely entertaining, all right? So I'm John from Titan. I look forward to talking to you guys soon. Don't forget, Valentine's Day is a couple days away. Make that lover special. Make them feel good in all the ways you can, all right? So I love you guys. Thank you for your support. I'm John from Titan, and I am out.